284,200 people are estimated to be diagnosed with breast cancer this year. That's according to the American Cancer Society. Of those, about 1% of them will be men. That's nearly 3,000 men diagnosed with breast cancer.
In terms of the men versus women, in general, the types of breast cancers all remain the same. The risk factors are also a little bit similar in terms of men and women.
While breast cancer in men is rare, it's also easier to detect in the early stages.
Men don't have that much breast tissue, so oftentimes when they have a lump, we can feel it or we can see starting some of the skin changes, particularly since most of the breast tissue is immediately behind the nipple and the colored part around the nipple called the areola. So those changes, that pulling in of the nipple or blood coming out of the nipple, are very obvious, whereas they're not always the case in women.
However, as with any type of cancer, the key to treating it is catching it early. Breast cancer can metastasize to spread into other organs like the lymph nodes, bones, liver, and even the brain. If the cancer progresses to this point, the prognosis can be much grimmer.
It's unfortunate that even though 1% of breast cancers are affecting men, actually the percentage of them who die is actually a little bit higher than women because it's later stage, because it's not brought to someone's attention.
So talk to your doctor if you notice a lump in your breast or if fluid is leaking from your nipple. An ultrasonogram or mammogram can check to see if it's a tumor or something more benign. These are the exact same tests used to diagnose breast cancer in women, and they work just as well on men.
Breast is like any other part of the body that we need to be attentive to. Just like you're checking your cholesterol levels to prevent stroke and heart attack, you need to be checking yourself and making sure you do not feel any concerning lumps.
The treatments for breast cancer are the same for men and women and can include surgery, hormone blockers, radiation therapy, or any combination of the three. The important thing is to be open and talk to your doctor if you have concerns.
Please don't feel embarrassed. In my 20-year career, I can't tell you how many men that I've treated, and oftentimes with good outcomes because they didn't wait.
This is a curable disease, and I think we all have to help each other out getting early diagnosis so that this can be cured.
Neil McNeil, Fox 8 News.